One day, there was a very happy family with a regular brain and a proper nervous system.
The nervous system is an organ system that coordinates the body's voluntary and involuntary actions and transmits signals between different parts of the body. Structurally, the nervous system has two components, the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain, spinal cord, and nerves. The peripheral nervous system is all the nerves that branch out from the spinal cord and the brain and travel throughout the body.
Then one day, strange things started to occur.
Schizophrenia is an internal disease caused by fundamental organizational differences in the brain, and it mainly affects the central nervous system. Malfunctioning dopaminergic neurons is thought to be a potential cause of schizophrenia. Dopaminergic neurons of the midbrain are the main source of dopamine, a neurotransmitter associated with movement, attention, learning, and the brain's pleasure and reward system. Schizophrenia can be noticed in a person's late teens through 20s. However, signs of it can be seen from early childhood. Schizophrenia causes the alteration of pathways and deviation of There are also enlarged ventricles in the brain causing further impairment of ability. The ventricles in the brain are a set of communicating cavities. It is responsible for the production, transportation, and removal of cerebrospinal fluid. Cerebrospinal fluid protects or acts as a cushion for the brain, limiting cranial injuries. It also prevents excessive pressure on the base of the brain and creates an environment to allow for proper functioning of the brain. People with schizophrenia have less gray matter. Gray matter is important because it contains somas and dendrites of the neurons. Schizophrenia prevents the brain from developing particular schemata. Schemata are patterns within the brain that represent and control different functions. Furthermore, there is damage to the eye function, which reflects an interpretation of sensory inputs done by a set of processes within the nervous system. There are three categories of symptoms for schizophrenia: overt, negative, and positive. Overt symptoms include delusions, hallucinations, alteration of the senses, inability to sort and then respond appropriately to incoming sensations, an altered sense of self, and changes in behavior. Negative symptoms include emotional flatness, inability to start or follow through on activities, brief speech, lacking content, and lack of pleasure or interest in life. For treating schizophrenia, patients usually require antipsychotic medications that block dopamine receptors and decrease dopamine neurotransmission in the brain. However, it can cause Parkinson's disease-like symptoms in some patients. Treatment can be effective at treating, but it is not a cure. Most patients must remain medicated for the rest of their lives.